How are men and women treated differently, even in 2025, in a hormone replacement clinic? After my twins were born, I had some pretty significant health issues, and one of the things that they talked about was doing troches for testosterone replacement because my testosterone was at like 2. That was my total testosterone, not free testosterone. In women my age at the time, it averages between like 75 and 100, and free testosterone is usually somewhere between 7 and 25. My total testosterone was at 2. They continued to monitor it. I did the troches, but the problem with the troches is you have to take them like every 3 hours, and while I'm at work, I don't always have time for that. Eventually, we decided on a different form of testosterone replacement, and I've been getting low doses of that pretty much since my twins were born, which kind of sucks. But whatever, I'm back to a normal hormone level for a female, and that actually has been feeling good. I have more energy, I have less brain fog, I feel more with it and ready to respond to life. Interestingly, same clinic does men's hormones, and they had tested my thyroid and said your thyroid's low based on a TSH, and we need to treat your thyroid. And I asked them to run a full panel, and it turns out that just my TSH was low. So my pituitary gland was having trouble, but not my thyroid. Fast forward to 2 years ago. I again get a notification that says, your thyroid's low. My TSH is low. Total T4, free T4 are both well within the A grade range. And my T3 and free T3 are in the A grade range. But supposedly my thyroid's low. But it's not my thyroid, it's my TSH, which is again my pituitary gland. They want to put me on Synthroid. And I'm like, why would you put me on Synthroid? I have enough T4 and I'm converting to T3. You're trying to medicate my thyroid to get to my pituitary gland, which isn't going to work because that's not how the system works. Meanwhile, my husband goes in and says, I've been feeling X, Y, and Z, and I feel like I have low testosterone and I meet the requirements according to the Adams score. Can we do some blood work? They do blood work and they come back and they tell him, your thyroid's low, but we want to do some further testing. This clinic then tested his selenium, zinc, iodine, D3, and total stores of D3. And they determined that his iodine, selenium, and zinc were all low and his D was low, and they were just going to have him take vitamin D, selenium, and zinc for a period of time and see if that raised his thyroid. They never once mentioned thyroid medication to him. I went back and said, hey, do you think that because you're measuring this for my husband, you could do the same for me? No, we just think you need to go on Synthroid. So you want my husband to take vitamins and minerals, but you want to put me on a medication that stops my stomach from producing stomach acid, which stops my ability to digest protein. And it also stops production of a specific stomach enzyme that helps me break down complex carbohydrates and regular carbs like bread and pasta. Their response: years of data says Synthroid is safe, you should just go on it. Ask more questions. Women are treated differently in every medical situation, even when it's the same provider. I bet if you ask your physician what causes high blood pressure, they still can't answer you. And all they have to know is that it has to do with homocysteine and restriction of the blood vessel. It has nothing to do with your kidney, and it really has nothing to do with your heart. And for 90% of people, it has nothing to do with your salt intake. I bet if you said, show me the peer-reviewed evidence that statin drugs reduce the risk of heart attack and stroke, they can't produce it because it doesn't exist. Because heart disease is still the #1 killer in the United States. The second highest cause is actually medical error. Antibiotics were overused for 40 years. The opioid epidemic started in a physician office. If we're so blinded to think that we're not allowed to ask questions of our physicians, that we don't know intuitively what's going on with our body better than somebody who has less than 3 minutes to spend with us in a room, we have a problem.